Alrighty, so for posterior hip precautions, we're gonna have no flexion past 90, no adduction of the hip, and then no internal rotation of the hip as well. And this also includes when you're pivoting for sit to stands.
All right, so in order to get a patient who just had a posterior approach total hip arthroplasty out of bed, we're going to first take the pillow or the wedge out. So I'm just gonna lift the drape here a little bit. Just a little bit there. And then that'll usually be Velcroed on, and you can undo the Velcro and take it off. And then just set it aside for now. And then I'm going to actually take off this blanket if that's okay. Make it a little easier to move around. And we can set that to the side as well. Okay, so the first thing I want you to do is prop up on your elbows. That way we're making sure we're not bending that hip up past 90. And then we're just gonna kind of shimmy. We're gonna go elbows and legs at the same time to bring your legs out toward the side of the bed, okay? And then I can help guide this leg that she just had surgery on, just to make sure that we're maintaining precautions. All right, so when you're ready. Good. Good, and then if you wanna shimmy up toward the front of the bed, perfect, and we can let that knee bend.
Okay, so now we're gonna go ahead and get you up and out of bed. I'm gonna raise the bed up a little bit here, just so that we try and keep you at a little bit more of that straight angle. Okay, so then I'm gonna come around here and I'm gonna place a gait belt on you for your safety. Just want to make sure you don't wanna slip or fall. I got you. So I'm just gonna come in and give you a nice big bear hug. All right. This is gonna be nice and snug. If it ever becomes too uncomfortable, let me know, okay? So, what I'm gonna go ahead and have you do here is I want you to try and scoot as close as you can to the edge of the bed. And on the count of 3, we're gonna go ahead and stand up. I want you to keep this leg straight, this knee bent, and I want you, if you're comfortable, putting one hand here and keep the other hand on the bed, and we're gonna push up 1, 2, and 3. Perfect. Ready to sit back down? All right, and to go ahead and sit back down, what I'm gonna have you do is I want you to scoot back until you feel the bed on the back of your legs. I want you to bring this walker close to you, and I want you to reach back behind you with this arm and keep that leg straight. We're gonna bend with this leg, and we're gonna slowly sit down. And I want you to bring this hand back and go ahead and lean onto your arms, keeping that hip. And one cue that I would like for you to remember is anytime that you are sitting and need to move around, or you need to go from laying down to sitting, I want you to maintain this lean back posture, okay?